Hey everybody, it's Jess DaMassa with What's the Future of Health. You have joined us for a very special interview being done in partnership with the Healthcare blog, which is why you are looking at Matthew Holt over there, the editor-in-chief and founder of that fine publication. And apparently, Matthew and I have been nominated to be the official welcome committee for Health Tech to welcome this guy back. Hello, you are looking at Glen Tullman. That is not a figment of your imagination. He is jumping back into the fray today, announcing that he is adding the CEO role to his executive chairmanship of consumer digital health company Transcarent. So Glen, welcome back. Tell us what you're doing. We're surprised to see you.
Well, first of all, it's great to be back. And I mainly came back just so I could spend time with both of you. But really, what Transcarent is about is focusing, as you said, it's consumer digital health, and it's really redefining the relationship that people have with their healthcare. We want to make it easier for people to stay healthy. And the way we're doing that is actually providing consumers and their families with a set of information, tools, and new choices that they didn't have before. So as we looked around the space, what we concluded was people really wanted three things. They wanted unbiased information, not information that someone was trying to get them to do something, but unbiased information. They wanted to see that information in new and different ways. And so they wanted to get guidance, but they wanted trusted guidance, someone who had their back. And last but not least, they wanted easy access. And so we put that together in a new kind of experience. And that's really what Transcarent is, which is it's redefining the experience that all of us have with healthcare.
Okay, so I want to unpack this, and dive in deep into Transcarent, the services that it provides. I also want to talk about some other stuff around this, particularly that whole health assurance SPAC and some of the other things that you've been working on in the meantime. We're not going to, now that we've got you back, we're not letting you out easy. So why don't you dive in and explain a little bit more about the how behind what Transcarent is going to deliver to these employees and the self-insured employers that are going to be working with your company.
So if you think about healthcare today, healthcare is more confusing, it's more complex, and it's more costly than ever before. And yet there's literally hundreds of innovative companies that are out there all trying to make healthcare better. So you look at the industry, you have payers, you have PBMs, you have actually health systems out there. And then you have all of those organizations that bring us innovation. So you have all of these wonderful silos of innovation. But when you get to the experience of you and I and our families and everyone else, even including Matthew, you find that experience isn't any better. In fact, the experience is worse than it was in the past. Say, how could all of these people work so hard and end up with an experience that wasn't really consumer focused, that didn't put consumers in charge? So the idea of Transcarent was to recreate from a consumer viewpoint, from an individual's viewpoint, what would you like your health experience to be like? And so what do you want in that experience? You want actually the unbiased information, you want to have trusted guidance, and you want access to the best places to get your care, wherever that is, whether it's a center of excellence, whether it's a local hospital, or whether that's at home. But you really want to be in charge of your care again. And healthcare today happens to us. And instead of that, we want to empower consumers. We want to put them back in charge. We want to make healthcare as easy as every other part of our digital economy is. For example, if you go on to book a flight, think about that. You go on to Travelocity. It's available whenever you want it, 24 hours a day. It gives you all of the information, not a subset. Doesn't say use this airline or that airline. Gives you all the information. It's totally unbiased. And then it guides you through that in a way that you actually trust. You trust they're giving you the best information. They're not biasing it. And then last but not least, it makes it easy to book it. You do all of that. Before, you had to have a navigator called a travel agent. We don't want you to need a navigator. We want software so good that you can take charge yourself and really feel good about the experience. And when you need to talk to a person, you should be able to do that in 60 seconds, 24 hours a day, whether that's one of our health guides or whether that's a physician, whether you want to chat, anything you want to do, you're now back in charge of your care. And what we found was the large self-insured employers, they said to us, we need help because right now, trying to navigate ourselves through all of these silos, trying to use 4 or 5 different care providers didn't make any sense. And that's really what Transcarent's about. It's about a different kind of experience that people are going to love.
So Glenn, I love the idea. On the other hand, 7 years ago, you were on Stage of Health 2.0 introducing Livongo, and there was really not much going on in the way of getting to people with diabetes and chronic conditions, and you were one of the first to do that. There wasn't much of a market. In those days, you were raising sort of $5 and $8 million at a time until you really grew the thing, right? Now you're coming back. You guys just raised $44 million, I think. You acquired Bridge, which is a Center of Excellence play. And then you're talking about all the great stuff that you're going to do. The market, though, is different, right? There's been hundreds of millions of dollars gone into the navigation space. There's a public company, Accolade. Just this week, Grand Rounds and Doctors on Demand merged to put together Telehealth plus all the navigation and second opinion stuff that Grand Rounds does. And as you said, the health plans themselves have not been sitting around doing this, whether they're biased or unbiased. So it's a different world you're coming into. Why now? Why do you think you have a shot at doing something different when you've already got all these companies playing in that space?
Well, the great news is we were asked to enter. So large self-insured employers actually came to us and they said, the existing system isn't working. And if you hearken back to when Haven was announced a number of years ago, what was interesting is you had 3 of the smartest, highest regarded companies in the world who had concluded that the payers, the PBMs, and even the health systems were no longer aligned with their best interest. They were after 2 things. We want high quality care for our employees and their dependents, and we wanted at an affordable cost. And their conclusion was that every time those costs went up, each of those 3 organizations, the payers, the PBMs, and the health systems made more money. So there wasn't alignment. And that was really a wake-up call for the industry. I think the industry missed it. And so here we are years later, and the fact of the matter is no one has built an aligned organization. Again, you mentioned some of the navigators out there. Well, navigation is one piece of it. But the way I look at it is if you broke a glass on the floor and I cleared a little space and I said, here, Matthew, every time you want to walk through here, I'll show you the way. You'd say, Glenn, why don't you just sweep the glass up? So, why do we have a navigator? Let's fix the problem. Okay. It's kind of like, if you hearken back to my prior life, if you remember something called Epic, and instead of fixing the software, what they said is, we'll hire someone to sit between the physician and the software to actually figure out how to enter that stuff. Well, fundamentally, that makes no sense whatsoever. So what we're saying is, let's fix the problem. Let's not have new navigators to help you go through it. Let's fix the problem. Let's put the people back in charge and do that. Now, we're able to do a lot of that in chronic condition management. And, the great news is if that's what you're looking for, virtual care, we think there's a great company out there called Teladoc, and they've been able to put that together. This is a much different approach that partners Transcarent with the self-insured employer and goes a step further. For example, in surgery care, you want to know, where should I get the care? Should I get it locally? Should I get it at a surgery center? Should I fly somewhere to get it? Then you want someone to walk you through it because it's the first time you had hip surgery or the first time you had shoulder surgery or whatever it might be. So you really need a specialist there who's intimately involved. And then afterwards, you want help recuperating. So walking you through that process in a way that's first focused on high quality and value, and then is actually focused on a speedy recovery, that's called alignment. And one of the things that's unique, that's very different about Transcarent is it's not a model where we get paid up front. We get paid a share of the savings based on performance. No one's really ever done it. A lot of people talk about it, but that's real alignment with self-insured employers. And so if I have a navigation company and I come along and I say, hey, pay me up front and I'll help navigate, that means I win even if I'm not effective because I get paid up front. You remember at Livongo, we changed the model. We said you only pay when people use it and when they keep using it. That was revolutionary. Now we're going to the next step and saying, we believe in this so strongly that what we're going to do is we're only going to get paid if it's effective. And people are like, wow, finally a true partner and finally someone who is focused on, first and foremost, the care of our people, and then second, making sure that we do that in a cost-effective way. And the system today is so dysfunctional that there's plenty of room to do that, to create an absolutely exceptional experience for people, all of us, and to do that in a very cost-effective way. So that's the bet we're making at Transcarent. It's a different business model, first and foremost. It's a different focus. We're truly putting people first. I mean, this is, if you remember, Livongo is very personal to me. My son had type 1 diabetes. It was very personal to many of the people who work there. And in a similar way, Transcarent is something we're building that I would want my own family to use. That's how important it is. And I can't say the same for putting my family through a lot of the organizations that we have insurance with today, a lot of the payers, because we know they aren't going to say, a hospital's not going to say, we're not any good at knee surgery, go to the place across town. It's not happening. You know, large payers aren't going to say, next year we want to cut our revenues in half. That's not happening. And yet we have that incentive, the same as our largest self-insured employers, as many of the other large providers of insurance in the market today. So we think of the payer not as a third-party entity, but as a self-insured employer and as all of us, because increasingly all of us are paying more for care. So I think that's the approach we're taking. That's why it's so different than anyone else out there.
So tell me, before we go on to the next part, tell me who came to talk to you and who are the first employers you're going to have on the system?
Well, I think that can be our next interview.
All right. First dodge, I see it.
I'm ready for Jessica to ask if you're going public yet, because that's where
Jess is going to ask that.
Don't worry.
I'm surprised she hasn't asked that already.
No, I'm going to ask you then.
But there are some, right?
No.
Yes, there are.
Good. Okay.
Frankly, I think our issue in this business was getting the offering ready much more than are there people interested, because, you know, fundamentally, there's no one out there who says, I'm tremendously satisfied with quality, the cost, and the experience of our healthcare today. It's just not out there. And so when you go and talk to large and mid-sized self-insured employers, when you go and talk to people, they don't rave about how wonderful our healthcare system is working today, how cost effectively it's working today. And yet it's more important than ever. I think coronavirus showed us that you can't have a functional economy unless you have a great healthcare system. And, you know, that's part of the takeaway here. And I do think that when we look back 10 years, part of what we're going to see is we're going to see that this was a year where the entire economy, not just healthcare, but the entire economy became a digital economy. And as a part of that, healthcare is getting dragged along. So the real issue is going to be, does our healthcare system as it exists today understand that shift, or do they try to move backwards back to the way it used to be? Do we say to people, don't use telehealth anymore, you should come in for your appointment? Or are we much smarter and do we say, no, telehealth is a key part of the future of healthcare, and we can make our doctors more efficient, our nurses and other caregivers more efficient by using digital technology and incorporating that in part of the process. And that can be for virtual care in all different ways.
I want to ask real quick on this whole idea of cost, because you talked a lot about that. One of the things that struck me when I read through the description of what Transcarent is doing is this idea of sharing back some of the financial savings that come out of this. And I want to ask about your model, because with all of the things that you're providing, health guide, second opinion service, the whole centers of excellence play, the whole med management, surgery management, the whole thing, it's like, it sounds to me, I said to Matthew, I'm like, this sounds like an insurance company without paying claims. So talk to me, I guess, a little bit about the payment on this side and how those financial savings get shared back in. It can't just be on the fact that they're just paying for utilization.
Well, the great news is that we do have a completely different model. So our members who come through our service, and I should mention that as we go to work with large self-insured employers, this is an opt-in program. So people can say, I want to stay with my existing payer. I want to stay with my existing health plan, my existing PBM. It is their choice because I believe in choice in healthcare. So first and foremost, we're not forcing anyone to do anything. This is not a narrow network or anything like that. We give people more choice, better information, better guidance, and we trust them that they're going to make better decisions. So that's a fundamental difference. Second, we don't have copays. Copays are out the window, billing's out the window. You don't see billing. So if you come to us and say, I need hip surgery, what's that going to look like? You're going to be talking to a specialist who gives you options. Here's the options in your market. Here's the quality assessments of those options. If you'd like to go to them, that's your choice. Here's the options. And those could be, by the way, a hospital. It could be a surgery center. It could be any kind of specialist that might be there. And you'll get a full choice of those. Then we'll say, now, if you want to fly outside the market, here's your options there. You can choose that. Some of those options, or we can say you can go through your existing plan. Pay your copay, pay your participation. But if you come through us, there's no copay. And actually, again, we'll provide these services to you and make sure we handhold you through the whole process. We know that the quality of care varies, even within a market. So if you have 5 providers, the quality of care will vary, the cost of care will vary. But today, if you're a consumer, you don't have any of that information. And your payer may only give you a choice of 2 of those. Well, they're not saying those are the 2 best choices. They're saying those are the 2 choices that they've negotiated with. We don't think that's the right way to do healthcare. We think that healthcare should look like every other market. You should make the choice based on quality and cost. And we trust that you're going to make the right decisions. And so do many of the large self-insured employers out there, because we know the existing plan's not working as it is today.
So let's dig in a bit on that. When you founded Livongo, the same year, a little company called Castlight went public. A lot of the same ideas. We're going to make transparency about who's available, what's the price. It's really struggled with it, and those types of transparency deals have really struggled with adoption, have really struggled to move, and haven't moved the market, and haven't really been a great business success, a great IPO, but the stock price didn't exactly do a Livongo. So why are you going to make it? Why is it different now? And what's going to be different about Transcarent that's going to actually move the needle, especially on consumer and employee adoption?
Well, I think having the information isn't enough. You actually have to close the loop. So, in the Transcarent model, it's not just about providing people with actually unbiased information and with trusted guidance. It's following through the whole process. So as an example, we acquired a company called Bridge Health. And when we did that, that became one of the foundational elements. Bridge was in the business of scheduling surgeries, and whether they be locally or whether they be in remote locations. And so what we were able to do there was able to leverage all that information. They were the largest player. They were already working with large self-insured employers, and they were actually able to provide people with better choices, again, and walk them through that. And if you look at their customer satisfaction, their net promoter score is above 90. So people love the fact that they were given choices, given more options, and that we didn't stop there. We made the connections, we introduced them, we walked them through the process, we followed up afterwards. We even did, whether it be, virtual physical therapy or in-person physical therapy, we scheduled all of that. But they were in charge, we kept them in charge. So, Bridge our merger with Bridge was a foundational element for this company because one of the key costs that employers face is surgery. And so doing that in a better way that was very focused on what each of us as health consumers want, paired with high quality and better information. And last but not least, you can do that very cost effectively. And let me give you one example. If I take one of our great centers of excellence that we work with at Bridge, what they tell us is about 1 of every 5 heart surgeries they get, they actually conclude the person doesn't need surgery. Think about that, 1 in 5. That's amazing. So the cost savings there are terrific, but forget about the cost for a minute. The quality of life and the improvement of telling someone, we've had a number of specialists look at this, and the great news is you don't need heart surgery. I mean, what better message can you deliver? So we know we do too many surgeries in this country, and that's one of the things we can do. So Jessica mentioned, expert second opinion. So that's really important, providing that at no cost to employees and actually saying to them, look, you're going to do something really serious. It always makes sense to get an expert second opinion. We'll provide that in a convenient way to you. There's no cost to you. Somebody to explain that to you, somebody to truly who cares about your best interest. And then if you do need the surgery, we want to get you to the highest rated place in the country and a high value option. And value is that combination of cost and quality. So some people are going to say, I want to stay right in my market. That's great. There's great providers. And sometimes it goes beyond just the facility. We all know the names of great centers of excellence, but sometimes we drill down to within that facility, who are the best physicians? And, we'll give you her name or his name and say, here's who we recommend, because we're working with partners that follow through, not just the surgery, but the recovery and the satisfaction level and the like. All of this information is available. Some of it from parties like Gaslight, but you've got to close the loop. It's kind of like if you think about Amazon for a second and you say, how does Amazon know what books I want to read? Well, they have all this information, but they close the loop and they say, Glenn, we think people like you would like these books. Here's some choices. And then they close the loop by saying, did I buy it? And if I buy it, they say, okay, our model works. And if I didn't, then they say it doesn't work. Well, that's what we were doing at Livongo. And now that's what we're going to do here, to say, let's give people the right information. Let's see what they like. Let's get better and better. So we're going to use data science, but at the end of the day, this is all about the consumer experience.
So real quick, in terms of actually rolling this out, you mentioned that telehealth and getting access to second opinions is going to be part of it. You probably know a telehealth company. Are they going to be working with you on this?
Well, we haven't announced any of the names of people who are working with us yet, but what I would say is this. Remember, go back to that choice principle. So many of the large self-insured employers we're talking about have made a choice in telehealth. They might have chosen Teladoc, for example, or they might have chosen another company, maybe Teladoc or something like that. So, but they made a choice. If they've made a choice, they can continue to use that choice. We're not out there to push any one solution. What we're out there to do is create an experience that makes it easy for people, whatever they're choosing, to use that and access that. So today, many people, whichever telehealth organization they're using, it's hard to get access. It's easier, as my son told me. He said, he was telling me about a great telehealth experience he had. And he said, I went on the internet, I signed up, I did it. I said, why didn't you go through our health plan? Way too complicated. That's what he said to me. And I said, but I think they include it. He said, it's not worth it. It's just, I just went out on the internet and I did it. Now I'm a member. And that's the situation. So whatever people are using, they can continue to use it. We're all about choice. And by the way, and I hope we work with many different organizations.
Okay, well, but how does this not put you into a conflict of interest with Teladoc as somebody who's on their board?
Well, because the point is, this is only goodness. In other words, if they're using it, we're not going in selling against somebody, whether it be Teladoc or someone else. If you're using someone, we would recommend you continue to use it. We're focused on the experience.
Okay.
So, you know, what we're focused on is a lot of the things they don't do. As an example, I mentioned surgery, walking through that whole surgery process
Yeah.
and the like. And if you think about it today, you know, you mentioned earlier kind of one of the recent mergers that was announced. And if you think about that, you know, what they did was they put two companies together. Well, that's great. And financially, you can add up those numbers. But what that didn't do was change the experience that someone has. So if you go into both those companies tomorrow, the experience is going to feel like two completely separate companies. That's what we're really after, which is creating, again, this experience that's very different in a very different kind of model for the self-insured employer. And that is an experience that works for each of us as individuals, for our families, but also works for the self-insured employers.
All right. So can I ask it? Can I ask it now? Can I do it?
Ask whatever you want.
Going public via SPAC? Evolve the question. Forget just going public. Now I got to know, you're going to go public via the SPAC? I mean, we're looking at the investors in the $44 million round that led to the bridge acquisition, and it was led by Seven Wire, your own VC fund. It was led by General Catalyst, Hemant, Taneja, who is also the CEO of the health assurance SPAC that you guys founded. So, I mean, drawing the dotted line here, is this the vision for the future to capitalize this quick?
Yeah, I would say that at Transcarent, we're very focused on building the company, and we'll do that in a very traditional way for a number of years in the future. So I don't think we're a SPAC candidate. You know, at what we did, we actually didn't do a SPAC. We did something called a hack. And just
What's the difference?
To head off Matthew, it's not H-A-C-K, it's H-A-A-C. And that's the Healthcare Assurance Acquisition Corporation. And healthcare assurance is an idea that Hemant Taneja from General Catalyst came up with. And this was this idea of what people will want in the future. What they want from their health and care is really the assurance that they're going to be taken care of. Not taken care of by a third party, but kind of taken care of from a health and care standpoint. And so the idea behind this was to focus on companies that will do that. And I think as the SPAC is out there, it's got some great members of the SPAC, and we're looking for candidates who will do that. You know, when you start the SPAC, you don't have any candidates. We didn't. And now we're evaluating a variety of areas that we think can change health and care in the future. And it's pretty exciting. I think the SPAC market in general, it's caused maybe a little bit of inflation from the standpoint of valuations, but I do think it's going to accelerate and get more capital into a space that needs it, and that's healthcare, because we have to solve the healthcare problem. We have to drive innovation. But no, Transcarent's not a SPAC candidate. That's one thing I can say for certain.
Okay, sure. I have like a year and a half of Livongo's not going public footage that leads me to be a little skeptical, okay?
All right. Well, referring to Livongo, Glen, you had quite the band put together there, and you're slowly dragging some of them back. We know John Howick has been dragged back in on the communication side. You're now back in the CEO. Hemant Taneja is still there as investor. Lee Shapiro. How long before Lee gets dragged back in to be CFO and Jenny Schneider gets a phone call and Zainberg gets a call?
Well, I think that look, it's very important that that Teladoc continue to be the global leader that we envision in virtual care. I think they're doing that. I think they'll continue to do that. And you know, we don't have any interest in taking any of the folks there. I sit, as you mentioned, on the board of Teladoc. They have incredible talent there. Anytime you merge two great companies, you don't need two CEOs, you don't need two CFOs, et cetera. Lee loves the fact that he's back running Seven Wire Ventures. I don't expect him to take another operating role anytime soon. And, I can't comment individually by every one of the folks you mentioned. I think lots of the alumnus from Livongo will end up running companies around the industry. And but in the interim, their first task is to make Teladoc realize the vision that we came up with when we put the companies together. And I think that's going to happen.
All right. What's ahead for Transcarent? You're in charge now, but I mean, you've been obviously working on things. Give us a little glimpse of what's coming down the pike, just to kind of round this out for us. You dove into the whole model, the whole everything. What's this year look like?
Well, I think this year is really about building our customer base. So, we're fortunate to have a tremendous amount of excitement and interest around the model. And, from that standpoint, I think over a period of time, you'll start to hear us announcing different clients who join us and who believe in the vision. And we'll partner with them to help us build this company, much as we did with Livongo and companies before Livongo. So it's exciting. We're a startup, albeit one that maybe is a little further along than many. We have, approaching 100 people now working in the company. And, we've been fortunate because of the merger with Bridge to actually have a great foundation to build upon. And that is, Bridge Health. And what really attracted me was not only their leadership in this space, because the MSK surgical space is very hot right now. But it was more important, it was a net promoter score of 90, which when you have the people using your services and you're offering your solutions who love you, that's really what draws me to businesses. And they had built a beautiful business there. And, that's our foundational element to launch this company. Yes,
I recall you talking about the net promoter score at Livongo quite a bit. Mr. Holt
wasn't 90 if I recall.
Yeah, it was
close. we didn't get to 90, but we worked hard on it.
You did all right. Last question, Glenn. So you're coming out of semi-stealth. People have been talking about Transcarent for a while. You were obviously around and about, but not formally attached. Now it's all official. What do you need? Who do you need? What kinds of people do you need? What kinds of
Are you trying to get a job right now?
Listen, I've been sitting around in my office for a year and a half.
What are you doing? Are you trying to get hired right now?
I'm giving him a free recruiting commercial. Come on.
Tell me if you're in the market for an angry British man.
Fortunately, we have a lot of openings.
Oh my God!
Go to transcarent.ai and you can look at it. But we have a great management team. You can go to the site and look at it. We've been able to recruit some really terrific people, and more will be joining in the near future. And now it's just about rolling our sleeves up and every day focusing on how do we create this new and different experience that really gives people what they want in healthcare. And that's where we have to get to, especially post-pandemic. This is the opportunity. We've proven that digital tools work. We have great digital tools out there, but now we have to focus on the experience. Again, one of the things I learned from my time in the electronic health record space, we had great technology, but we didn't make it usable for physicians. And consequently, while it was a necessary condition to move forward, it wasn't sufficient to solve the problem. And we're still stuck with that years later. And so I think the goal here is to take all of this wonderful technology from many partners and put it together in an experience that puts people back in charge of their care, that really allows us to, take advantage of the promise of what can be in healthcare. And we've seen it. We've seen this past year, with all of the terrible loss of life, with the economic challenges, with the behavioral health challenges that we're facing today and will face. We've also seen how good we can be in a year developing multiple vaccines that used to take 10. And now we're seeing, finally having some leadership, we're seeing that we can get millions of people vaccinated in amazing efforts. And we saw the amazing efforts by our physicians and nurses who stepped up, put their lives on the line, and essential workers. And so there's some goodness in this story too. And part of that goodness is going to be the opportunity to rethink how we deliver health and care. And that's what Transcarent is all about.
Well, I can't speak for my curmudgeonly friend over there, but I have to say, pretty excited to have you back. to watch this whole thing unfold now.
I'm excited too. Come on.
You're trying to get a job there. I mean, I can't, don't even talk to me anymore.
I was happy to get a job there. So
tough contest. Well, they've got a CEO. I'm not sure I want the other job.
No, the executive chairman, I'm sure, reviewing those resumes, yours got ticked right up to the top, right? Yeah. All right. Well,
I think the idea was nobody else would hire me, so you got to start your own thing.
Unemployed, unemployable.
I would replace Holt. You could have jumped right into this whole mess. Next time, after this one finishes its course, then you can come back and work with me.
Sounds great.
All right, good. Well, we've missed you. We're happy to have you back. Welcome. Welcome back again.
Great to be back. Great to see both of you.
All right, you guys. Well, thank you so much for joining us here today. What's the Future Health in partnership with the Healthcare Blog. You can check out more content from the both of us, both Matthew Holt and I. To hear what Matthew's got to say, please head over to thehealthcareblog.com. Great editorial coverage of what's happening in healthcare, health policy, and health technology. And over on my channel, you can find more interviews with the movers and shakers of health tech and healthcare innovation. And of course, thank you so much to our special guest, Glen Tullman, Executive Chairman and now CEO of Transcarent. Welcome back, Glen. We'll talk to you soon.
Thanks, everybody.
All right, bye, guys.